Hello everyone. Today, we're diving into the world of a medication called Infliximab, commonly known by its brand name, Remicade. As with all our discussions, this is meant for educational purposes. If you have health-related questions or concerns, always reach out to a medical professional. Description: Infliximab, often recognized by its brand name Remicade, is a monoclonal antibody that falls under the category of TNF-alpha inhibitors. Its primary function is to reduce inflammation by blocking the action of a substance in the body called tumor necrosis factor alpha, TNF-alpha. Infliximab is administered through intravenous infusion and is primarily prescribed for autoimmune diseases such as rheumatoid arthritis, Crohn's disease, ulcerative colitis, ankylosing spondylitis, psoriatic arthritis, and plaque psoriasis. It helps reduce the symptoms of these conditions, like pain, inflammation, and damage to the joints and other tissues. Additionally, it has shown efficacy in managing and maintaining remission in Crohn's disease and ulcerative colitis, improving the quality of life for those affected. Warnings: Infliximab comes with its set of precautions. It's crucial to be aware of potential serious infections, as the medication can weaken the immune system. Before starting Infliximab, a tuberculosis (TB) test is required, and periodic monitoring for infections is recommended. Patients should also avoid live vaccines during treatment. There are risks of lymphoma and other malignancies, especially in children and adolescents. Other serious potential side effects include liver injury, heart failure, and blood disorders. Those with a history of chronic infections, hepatitis B, or demyelinating disorders like multiple sclerosis should exercise caution and discuss their conditions with their healthcare provider. Before taking this medicine. Before starting Infliximab, several factors need consideration. It's essential to inform your healthcare provider if you're allergic to the drug or any of its components. If you have a history of heart failure, infections, diabetes, or any other significant health issues, it's crucial to discuss these with your doctor. Women who are pregnant, planning a pregnancy, or breastfeeding should consult with their healthcare provider before starting treatment. Regular monitoring and medical evaluations are necessary to ensure the safe use of Infliximab. You should not take Infliximab if you have moderate to severe heart failure. Inform your doctor if you have any signs of infection, such as fever, cough, flu-like symptoms, or open sores, before starting treatment. It's also important to let your healthcare provider know if you've had or been in contact with someone who has TB. Side effects: all medications can have side effects, and Infliximab is no exception. Common side effects include respiratory infections like sinus infections and sore throat, headache, and infusion-related reactions such as fever, chills, chest pain, or trouble breathing. These reactions typically occur during or shortly after the infusion. Serious side effects can include severe infections, hepatitis B reactivation, heart failure, liver problems, and blood disorders. Symptoms of severe infections may include fever, persistent cough, weight loss, or fatigue. Signs of liver problems may include jaundice, dark urine, severe fatigue, or abdominal pain. If you experience any severe side effects or signs of allergic reactions such as rash, itching, difficulty breathing, or swelling of the face, lips, tongue, or throat, seek medical attention immediately. Interactions: Infliximab might interact with other medications, particularly other immunosuppressants and certain vaccines. It's of utmost importance to inform your doctor about all medications, supplements, and herbal products you're currently taking to avoid any adverse interactions. Dosage: correct dosage is vital for the effectiveness of any medication. Infliximab is typically administered as an intravenous infusion. The dosage and frequency depend on the condition being treated, patient weight, and response to therapy. For example, the initial dose for rheumatoid arthritis is 3 mg per kilogram, followed by additional doses at 2 and 6 weeks after the first infusion, and then every 8 weeks. For Crohn's disease and ulcerative colitis, the initial dose is 5 mg per kilogram, followed by doses at 2 and 6 weeks, and then every 8 weeks. It's essential to adhere to your doctor's recommendations and schedule regular follow-up appointments to monitor the treatment's effectiveness and safety. Avoid: while on Infliximab, avoid live vaccines and maintain regular hygiene practices to reduce the risk of infections. It's also advisable to inform your healthcare provider of any recent or planned surgeries. Given the potential for dizziness or other side effects, it's wise to be cautious when engaging in activities that require alertness until you know how the medication affects you. FAQ: Many wonder about the age restrictions for Infliximab. It is approved for use in children aged 6 years and older for Crohn's disease and ulcerative colitis. However, the safety and effectiveness in children younger than 6 for these conditions, or for other indications, are not well established. Always consult with a healthcare provider for any specific queries related to this medication. Closing. That wraps up our overview of Infliximab. Remember, this information aims to educate and should not replace professional medical advice. Always consult with a healthcare provider for any questions or concerns. Thank you for tuning in.